my name is Shi. I'm your nurse today. So before I start, I just want to let you know, during the assessment, I will be asking you some questions about your health. And during the physical assessment, I will be touching your body. Are you okay with this?
Yes.
Can you tell me what brings you here today?
I just want to check my lungs.
Did you have a cough?
No.
Did you feel shortness of breath?
No.
Did you feel chest pain when breathing?
No.
Did you smoke?
No.
Did you have a history of respiratory infections?
No.
Where did you work? Did you expose to any environmental toxin or pollution?
I don't think so. I work in the office.
When was your last TB skin test?
Last year.
When was your last chest x-ray?
Also last year.
Did you get your flu shot for this year?
Yes.
Do you self-identify as indigenous people?
No.
I will do inspection, palpation, percussion, and auscultation. So we start from the back of the chest. So when I look at the patient is breathing. His respiratory rate is about 16 beats per minute. I count half minute times 2 because he has a regular rhythm. He also has a normal depth and a normal effort of breathing, because I don't think he uses a lot of extra muscle or extra effort to breathe. I don't hear any abnormal sounds or noise, and he doesn't have any deformity or asymmetry. Now we look at the chest wall. The chest wall is symmetrical in an elliptical shape with downward ribs angled about 45 degrees in relation to the span. And spinal processes is also straight. And anterior posterior diameter should be less than the transverse diameter. For this patient, the front and back diameter is 20, transverse is 40, so normal ratio is 1 to 2, so this patient is normal. And next, I can see the skin is smooth, even, and the color is consistent with his cultural background. And the patient is sitting here, he's pretty relaxed and comfortable, and he can support his own weight, so the position is also normal. Next, I'm going to palpate the patient. I will put on my glove. And first of all, I'm going to palpate the chest expansion. I place my left hand over the left shoulder blade, right hand over the right shoulder blade, and slice the both hands to the middle to pinch up a skin fold. And then I will ask patient to take a deep breath. Can you take a deep breath? I can see my both hands move away symmetrically. This is mean the chest expand symmetrically. Next, I'm going to feel the vibration. So first of all, I'm going to locate the top and the bottom of the lung. So C7 marks the top of the lung. How to find the C7? We can ask patient to flex the head and feel the most prominent bony. This is the C7. And the T10 marks the bottom. We know the lower border of the shoulder blades is at the level of the 7th or 8th ribs, and then we count 2 more ribs. Then that's the T10. So I will use the ball of the finger to feel the vibration from the top to bottom, side to side, and make side-to-side comparison. I will ask patient to say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
So I feel strong and symmetrical vibration, so it is normal. Next, I'm going to use my finger to gently palpate the entire chest wall. So I'm looking for the any lumps, masses, lesions, deformity, or tenderness. Do you feel any tenderness or pain?
No.
So no pain or tenderness reported, and I don't feel any lumps, masses, lesions, or deformity. Next, I'm going to do the percussion. So I will do the percussion from top to bottom, side to side, and also make a side-to-side comparison. And laterally, I will percuss from the axilla all the way down to the 7 and 8 ribs. And I will percuss the top of both shoulder and the space between the ribs in a 5 centimeter interval. And I will try to avoid the shoulder blades and the ribs. This is my stationary hand, and this is my stroke hand. So I can hear low pitch, clear, hollow sound all over the lung, and I don't hear any soft muffled sound. Next, I'm going to auscultate the patient. I sanitize and warm my stethoscope, and I use the diaphragm of the stethoscope to listen from the top to the bottom, side to side, and also make side-to-side comparison. And laterally, I will auscultate from the axilla all the way down to the 7 or 8 ribs. I will ask patient to sit and lean a little bit forward and breathe through the mouth. And I will listen at least one respiration at each location. So I hear vesicular sound all over the lung area, which is low pitch soft sound, and I can hear bronchial vesicular sound between the shoulder blade, which is moderate pitch and a moderate loudness sound. So overall, the patient has a good bilateral air entry with no adventitious sounds like crackle or wheezing, which sounds like popping or bubbling respectively. Now I'm looking at the front of the chest. So the top of the lung is 3 to 4 centimeters above the inner third of the collarbone, and the bottom is rests on the diaphragm, which is the 6 ribs middle of the collarbone. So when I look at the patient has a regular respiratory rate rhythm, normal depth, and effort of breathing. I don't see any indentation or any bulging in the space between the ribs. I don't hear any abnormal sounds. I don't see any asymmetry or any deformity. Facial expression is relaxed, and the patient is awake, alert, and cooperative. And the skin is smooth, even. Color is consistent with the cultural background. I don't see any skin lesion. I don't see any facial skin tone blue or white, and the chest wall is symmetrical in an elliptical shape with downward ribs, and bottom at the angle at the bottom is less than 90 degrees. Patient sitting here, he's pretty comfortable, and he can support his own weight, and his abdominal muscle is appropriate for the age and the gender. Now I put on the glove and palpate the chest expansion. So I will place my hand over the lower lung, and with the thumb pointing to the middle line, and ask patient to take a deep breath. So I can see my hand move away symmetrically, and then I will feel the vibration. So I will ask patient to repeat the word 99.
99, 99, 99, 99, 99, 99, 99, 99.
So I feel vibration from the top to the bottom, side to side, and also make side to side comparison. So I feel the strong and symmetrical vibration. And next I will gently palpate the chest wall. Did you feel any pain or tenderness?
No.
So no pain or tenderness reported, and I don't feel any lumps, masses, lesions, or deformity. And the skin temperature and the moisture are normal. Next, I will do the percussion. So I will percuss from the top to the bottom, and also side to side, and also make side-to-side comparison. So I can hear the low pitch, clear, and hollow sound all over the lung region, and I hear the soft muffled sound over the liver region, which is at the right side, in the space between the 5th and 6th ribs. And next I will do the auscultation. So I will sanitize and warm my stethoscope, use a diaphragm to auscultate the lung from the top to the bottom, and side to side, and also make side to side comparison. So I can hear the bronchial sound, which is loud, high pitch, hollow sound over the neck, and I can hear bronchial vesicular sound around the chest bone, and I can hear the vesicular sound over the lung region, which is soft and low pitch sound. And overall, I don't hear any adventitious sounds such as crackle or wheezing, sounds like popping or bubbling, respectively.